for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Living a Longer and Healthier Life show. We are going to talk a lot about the vascular system this evening. We have Dr. Keith Jones, a vascular surgeon. He's on staff at St. Mary's Medical Center with Tenet Florida Physician Services in Palm Beach County at the Palm Beach Neuroscience Institute. I will give out that info in a bit. A little bit about Dr. Jones. He's board certified in vascular surgery. He's also fellowship trained in vascular surgery, so we're so lucky to have him. So without further ado, I want to welcome Dr. Jones to the program. Dr. Jones, how are you doing this evening?
I'm good. Thanks for having me.
Yeah, and thank you for taking us. I always say on this adventure of health because we always learn so much from the doctors we have on. So let's get right into it. Like vascular surgery, I really didn't know what this was until just a few years ago. Tell us a little bit about that medical specialty.
Sure, absolutely. So vascular surgery is a specialty that's been around for a very long time, since the 1940s, 1950s. And since that time, it's a specialty that has expanded dramatically. I mean, we went from doing mostly open procedures to now doing almost everything endovascularly. So with minimally invasive approaches, wires, catheters, and needles, we can do the same operations 40, 50 years ago in half the time with half the complications.
And I'm kind of smiling because we went from open to minimally invasive. That is so much better for the patient. Not that we weren't doing things greatly, in the past, but I know minimally invasive is sometimes a shorter hospital stay, less infection. We talk a lot about on this show, and how you're doing things endovascularly where you used to do it open. I think that is really neat how it's moved in that direction. We kind of talk a lot of baby boomers on here, adult to baby boomer and beyond, because a lot of people are living over 100 years old right now, right?
Octogenarians up to 100 years old and above. Yeah, absolutely.
So tell me a little bit about how you can help that population. I know there's a different, so I'm 42 years old. I always say that. I know it's a different type of ailments for different ages, right?
Right. So because of that population, the baby boomers reaching a much older age, typically they could present with a multitude of issues, multitude of medical problems, from carotid disease to aneurysm disease to peripheral arterial disease when they have issues walking, or wounds and ulcers that don't heal, to even issues with dialysis and having end-stage renal disease. So the spectrum of disease that we see is very broad, especially when we start taking care of patients that are approaching their 80s, 90s, and above.
Of course, and that's a lot to do, I should say, with blood flow, right? Vascular blood flow, going down to the lower extremities and coming back up, right?
That's correct. We cover everything from the neck all the way down to the toes, arteries and veins included. So if there's an issue with blockages, with aneurysms, with narrowings, we cover it all.
That's a good point. So, yeah, from the neck all the way to the toes. So we talked a little bit about the older population, and we are going to get into all those ailments as well this evening. But does the younger adult population ever have vascular issues? Because I think, I'm always thinking this is an older person's, type of ailment.
Sure. No, actually they do. They're not quite as common as some of the ailments that we see in the older population. However, you do find young adults with issues with their kidneys where they require dialysis. We also see problems from time to time in athletes, especially athletes that are pitchers or football players that do a lot of repetitive motions with the arm. Sometimes they can develop a syndrome called thoracic outlet syndrome, where essentially the muscles that cover the arteries and veins that travel to the arm can be blocked or obstructed. You can get blood clots to form there. And sometimes we have to go in to, break up the clots or blockages that are there, but sometimes even go in and remove parts of the muscle, parts of the bone in order to free the space up to allow blood flow to flow freely through that area. There's another condition in runners, what we call popliteal entrapment syndrome. So similar issue, the more you run, the more the muscles build up and develop, and you can get blockages of arteries there as well, creating problems with blood flow to the legs and feet that we sometimes have to do operations on, including bypasses, in order to help facilitate blood flow.
I'm smiling because I just learned something. I've researched you all day today, and Yeah, say it again. It's popliteal entrapment.
Yeah, popliteal entrapment syndrome.
That is just amazing. I didn't even know that existed. Wow, and runners get that.
Runners, big time runners. It
Okay.
depends on how the muscle fibers sort of develop while in embryo, and depending on how those fibers develop and sort of grow over time, you can get issues with blood flow through that artery.
Huh, hear that. You learn something new every day on the show. Again, we're here with Dr. Keith Jones. He's a vascular surgeon with Tenet Florida Physician Services, on staff at St. Mary's Medical Center, great hospital, level 1 trauma center in West Palm Beach. Dr. Jones is, his office is also in West Palm Beach, 901 Village Boulevard, Suite 702 in the Palm Beach Neuroscience Institute. Great practice right there in West Palm Beach. So we talked a little bit about, the younger and adults. I want to get into some of the your areas of interest for treating, vascular ailments. Minimally invasive and endovascular therapy. I almost can't say it. Tell us a little bit about that. I know you touched on it before, but
sure. So it has revolutionized the way we treat vascular surgery, and we're talking about procedures that can be done in an office setting, sometimes being done in an outpatient setting, can be done without the use of general anesthesia. We can do sort of local anesthetic and some sedation. We can open up blockages in the arteries in the neck, open up blockages in the arteries in the legs with stents, angioplasties, and patients are up and walking the same day. We can fix large aneurysms in the abdomen as well as in the chest, again, with just wires and catheters, no incisions, no cuts, and people are up walking, sometimes out of the hospital the next day or the day after. So
wow.
We're talking about a decrease in hospital stay. We're talking about decreased morbidity, mortality, and in some instances cost as well. But for the most part, it's definitely a lot less stress on the patient to have a big incision versus doing something minimally invasive.
I know we have lots of types of doctors on this show, and they save lives, but I don't think more so than any other specialty, vascular surgery is really saving lives, because if that blood flow isn't, corrected or you find another path, there could be stroke. There could be, you could lose.
That's correct. You can have strokes. You can lose limbs, arms, legs. For the biggest procedure that we do that has the biggest morbidity and mortality is an aneurysm or ruptured aneurysm. And, just looking at the numbers of those patients, only about half the patients who come to the hospital with a ruptured aneurysm will actually make it to the hospital. And of those people that make it, 80% likely won't leave the hospital. So it's one of the biggest vascular problems that we encounter, that we see, and that we're very aggressive with trying to treat with surveillance and community outreach to make sure we can pick up those patients with aneurysms, because a lot of people are walking around with aneurysms and they don't know that they're there. Typically, how we most commonly find them is incidentally. So the patient comes in for some other reason, and incidentally, you notice that they have an aneurysm either on ultrasound or on a CAT scan. The other reason that they come in is either they're ruptured or they're having back pain or abdominal pain, and that makes it a little bit more of an emergency in order to treat.
I'll just add on to that. Everyone will remember we had a gentleman on the show about a year ago who told his story. He was sitting on, a 53-year-old man, sitting on the couch with his girlfriend watching a movie, had sudden, severe back pain, told his girlfriend, hey, call 911. Something's not right. I've never felt this before. He had an abdominal aortic aneurysm, and he went through many hours of surgery. I mean, he told me how many hours. I couldn't believe it. Like, that surgeons are standing there, like, never giving up. And he was saved because he noticed the sign and symptoms, and he, more importantly, called 911, right, and
Absolutely.
get to the near. The ambulance crew will take you to the correct spot most of the time.
Right. So in situations like those, time is of the essence.
Yeah.
So the sooner you can get to the hospital, the higher the chance of you actually surviving the event. But again, just going in, seeing your doctor on a regular basis, having yearly checkups. Those things can also help to pick up on vascular disease and hopefully prevent progression of a ruptured aneurysm or the threat of limb loss.
Because what preventative medicine is better than any other kind of medicine, right?
Absolutely, without doubt.
You're a vascular surgeon, but you'd rather prevent it before the fact than go through like a more of a trauma case, right?
That's correct. And I have this conversation with my patients in the office all the time. We counsel them about smoking. We talk to them about diet and exercise and those things are preventative measures to help either prevent or slow the progression of vascular disease. Smoking is probably the number one risk factor out there that if you cut it out, you reduce your peripheral vascular disease or risk of amputation, aneurysm dramatically. So one of the things I preach to my patients all the time is stop smoking, stop smoking, stop smoking.
And we say that on the show as well. We're here with Dr. Keith Jones, vascular surgeon, St. Mary's Medical Center, Tenant, Florida Physician Services. He's over in the Village Boulevard area, I should say, of West Palm Beach, 901 Village Boulevard, Suite 702, West Palm Beach. The number's 561-437-0588. We have about a minute till the break, so I just want to ask you one other thing. Are there different symptoms for aortic and peripheral aneurysms between men and women? Because I was just wondering that, because I know with men and women it can be a little different.
In terms of the presentation, not necessarily. Usually if they're symptomatic from an aortic aneurysm or peripheral artery aneurysm, either mesenteric or renal or in the legs, the presentation is about the same. Now, in terms of size, we're a little bit more aggressive for treating women at a smaller size than men, just because the natural size of the vessel is a lot smaller for women than it is for men.
I see. And do you go through the groin when you're going endovascular, or for that type of ailment, or are you going through another area?
For the abdominal aortic aneurysms, typically it is through the groin. Sometimes if it's a little bit more of a more complex procedure, we may also access the arms as well in order to treat it. Yeah.
And that everyone's the groin, that's just a big artery, huh? Is that the femoral?
That's correct. It's the femoral artery.
Femoral. Thank you.
I
was close.
Yeah, absolutely. It's a direct path to the aorta and gets us there very quickly.
That's the one.
And patients tolerate it very well.
Well, that's good to know, because, we're wondering. We're not in surgery every day, very rarely, actually. Never.
Absolutely.
No, I've attended 7, since I've been in PR for healthcare. I find it fascinating to be invited in there. Well, let's take a quick break. On the other side, we're going to talk a lot about peripheral arterial disease, because I know that's growing, limb salvage, and other vascular ailments on the You and Your Doctor show.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida, and welcome back to the You and Your Doctor show. We're here with Dr. Keith Jones. He's a vascular surgeon with Tenant, Florida Physician Services at St. Mary's Medical Center in West Palm Beach, and then his office is 901 Village Boulevard, Suite 702, 561-437-0588. He's in West Palm Beach. Oh, Dr. Jones, we were talking a little bit about peripheral arterial disease, and I've actually seen this term a lot lately. PAD is the acronym. What is it, and why should we be a little, I guess, concerned about it, right?
Sure. Peripheral arterial disease is one of the major conditions that I see in my office on a daily basis, and it typically involves the lower extremities. There are basically three different categories in terms of disease severity. One is called claudication, the other is called rest pain, and then the third stage is tissue loss. What claudication is pain with exercise or ambulation that's relieved with rest. And sort of how I explain it to my patients, it's sort of a supply and demand issue. So when you're sitting, the supply and demand are equal. You have enough blood flow going to the muscles that you feel fine. But as soon as you start to get up and walk, you're using more muscles, more oxygen, more energy expenditure. And so those muscles need more blood flow in order to propel you and carry you. But if there are blockages within the arteries or narrowing somewhere along the course of the blood flow, supply and demand doesn't equal. And so people tend to complain about crampiness in the legs, fatigue, pain, and heaviness. And that doesn't go away until they stop walking. And every patient is a little bit different. It depends on how severe the blockages are. If there's collateral blood supply, some people can say, hey, I can walk 3 blocks before having symptoms. There's some patients that I see that can barely walk around the house. So there's different severities in terms of claudication. The second stage is called rest pain, which is a more advanced stage of peripheral arterial disease. And it is just what it sounds like. It's pain at rest. Typically, patients will come in the office and say, hey, I can't sleep at night. And why? I have pain in my toes and my forefoot, and to the point where I sleep either with my leg hanging off the side of the bed or I sleep in a chair. And the reason for that is because you have gravity helping to bring blood flow down to the foot. And when they're in a recumbent position, gravity is not assisting them. And so they have pain in the toes and the foot because that's the furthest part away from the heart. And in those patients, we have to be much more aggressive about treating because the risk of limb loss tends to go up in patients in that category. The final category is called tissue loss, and that's patients that present with non-healing wounds, non-healing ulcers, people that have gangrene of their toes. Mm-hmm. That's a limb-threatening process, and without doing any aggressive treatment, patients can rapidly go on to losing toes or foot, or in some cases, their legs. So with endovascular interventions, with bypasses, all these aggressive limb salvage techniques that combines not only vascular surgery, but podiatry and infectious disease, we can aggressively work to try and save that limb.
Yeah, because the mortality rate is very high after amputation, right? In that first and second year and even beyond, right?
Absolutely. Yeah. That's why we're very aggressive when it comes to that.
So sometimes when, just hypothetically, if one orthopedic surgeon or someone wanted to, amputate the leg, someone would come to you as a second opinion and limb salvage. Is that how it works?
Well, typically the patients are usually referred from an internal medicine doctor or podiatrist, and sometimes they don't know exactly what to order, so they'll come to us to say, hey, maybe you need to see a vascular surgeon to see if this is nothing or is this something we need to be worried about. And then based on that, we can order a variety of tests and workups to see whether or not it's something that we need to do before being more invasive, like with an angiogram or a bypass. Sometimes you can treat patients' symptoms with medications, sometimes not smoking, sometimes exercise can alleviate those symptoms when it comes to claudication. Some of the other more aggressive categories we typically are more aggressive with.
I think the key word right there is in his areas of interest, limb salvage. I mean, he is going to work to salvage the limb any way he can, and that's going to give a better rate of, returning to a quality of life and survival, right? So that's so important.
And overall cost, because once the limb is amputated, you have to expend a lot of resources for rehab and prosthetics and post-operative care. So whatever we can do to sort of save the limb and promote the patient's independency, we try to do.
Okay, that's a great explanation on peripheral arterial disease and limb salvage. Wow, we learned a lot right there. Let's talk a little bit about this. I find this fascinating because I never thought vascular with like renal and the kidney dialysis access. So that's part of the vascular system, though, right? I don't think common people really think of that vascular, right?
No, that's absolutely true. So renal artery disease and dialysis go hand in hand. Typically, we see patients that are diabetic, usually long-standing diabetics, or patients just with extensive atherosclerotic disease that can also block the blood flow to the kidneys. There's usually one artery that goes to each kidney that supplies the blood flow. And just like you can get blockages in the arteries to your heart or to your neck or to your leg, you can get those same blockages in the arteries to your kidneys. And if this blockages is severe enough, it can obstruct blood flow, and you can end up with kidney failure as a result, in a combination of other issues with diabetes, high blood pressure. That's typically what contributes to renal disease. And in those patients that are advanced, that we can't treat it, then we have to have discussions about dialysis. And dialysis is done with either the use of a catheter, just temporarily, or we put what we call a shunt or access in the upper extremities. Sometimes we have to put it in the lower extremities. And this access can be at the level of the wrist, the forearm, the elbow, or the upper arm. And basically it's a connection between an artery and a vein. We wait for that system to sort of develop in size. Once it reaches a certain size, the dialysis machine sort of takes over the role of the kidneys. So there's a special needle that goes in, brings blood out. The machine cleans the blood, and the other needle brings blood back to the body. Typically, that process takes about 4 hours, and it's usually 3 times a week.
I always wondered how that worked. Wow, another great explanation. We're learning a lot on here with Dr. Keith Jones. We got about 2 minutes. He is a vascular surgeon, West Palm Beach area, St. Mary's Medical Center, 901 Village Boulevard, Suite 702 in West Palm Beach is his office, 561-437-0588. Ton of info on www.tfpsdocs.com. That's tfpsdocs.com. We have all of Dr. Jones's info there. Yeah, we got about a minute and a half. I'm just going to skip right to the curveball question because people can look you up. So what are the great explanation, though, on everything? What are your hobbies and passions in life outside of medicine?
So I'm a big-time runner, so I
Really?
do half marathons and 5Ks and things like that. So I'm a big-time runner. I like traveling. Although, being busy kind of prevents me at times. But
South Florida's going to keep you busy, I have a feeling.
Exactly. So I like traveling. But most of my time is spent with my pride and joy, my wife, Giselle Vasquez, and my son and daughter, Gabriel and Julia.
Oh, nice. That's nice. Nice to hear. Yeah, and you're originally from Memphis, right?
Originally from Memphis, Tennessee.
Great city.
Lots of great barbecue.
Yeah, and Beale Street and Graceland and Sun Records.
Absolutely.
I got a chance to go there once with FAU football.
Okay.
And they were actually playing at Arkansas State over in Jonesboro, but Howard Schnellenberger had us stay in Memphis. Pretty cool.
It's a very nice city.
So glad to have you. And you were over in California for a little while and in Miami. So everyone can check that out on Dr. Jones' bio. Again, it's tfpsdocs.com. Love to have you on again. It was fascinating.
My pleasure.
We'll see you next time on the You and Your Doctor Show.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management,